Hey, it's Tane. I'm here with Dr. David Bowell, public health physician and former WHO medical officer. What are the main reasons we should be concerned about the WHO's pandemic treaty?
So it's concentrating decision-making for pandemics with the WHO. Firstly, it's an inappropriate organisation to do that. It's not a technical organisation, it's a bureaucratic organisation primarily. And concentrating control of a complex public health emergency in a central organisation doesn't make sense. We saw in COVID where we had exactly the same management for elderly people in nursing homes as children. It's a mad way to do public health. But the most important issue is that this is a really rare thing. They have grossly exaggerated the risk of this, and so they're putting in place at a very high cost to taxpayers a situation where they will have huge surveillance for viral variants. They'll find them. This is nature. They're surveilling for nature. They will then declare a risk of a pandemic. They don't even need to have actual harm, but they just have to have a threat. They can lock down people. We've seen this through COVID, so this is what will be recommended. There's a 100-day mRNA vaccine program where vaccines can be mandated or given as your way back to freedom. And this will generate hundreds of billions of dollars for the corporations, the pharmaceutical corporations, which are very influential now on WHO. This is a big change. They never used to be. WHO used to be about following countries' interests, following the interests of populations, concentrating on high-burden diseases that kill a lot of people, like malaria, TB, etc., and things like sanitation and so on that actually improve life expectancy. But you can't make a lot of money out of that. There's a lot of private investors now in WHO, and they're interested in a return on their investment. So we've seen an organisation change to one where essentially you have commodities, particularly vaccines, as an answer to health problems, and you exaggerate the health problems where they can be used. And this is where these agreements are taking us. It's sort of what we've seen with COVID, but making that a permanent fixture of the way we live.